Welcome to Nevada Orthopedic and Spine Center. In this video, we will demonstrate how to properly apply and care for your hip surgery dressing to promote proper healing. Before starting, wash your hands thoroughly. Gather your dressing supplies, which includes primary collagen dressing and secondary adhesive dressing. Make sure the area around the incision is clean and dry before applying the dressing. Carefully remove the old dressing from the surgical site. Be gentle and avoid disturbing the wound. Dispose of the used dressing appropriately and inspect the surgical site for signs of infection, such as redness or unusual drainage. Place the primary dressing over the surgical incision. Ensure that the dressing fully covers the area and extends beyond the wound edges. This will help absorb any drainage and protect the site. Next, apply the secondary dressing over the primary gauze. If the secondary dressing has an adhesive edge, peel the release paper back and press the adhesive onto the skin around the wound. Ensure the dressing is secure but not overly tight. Once the dressing is in place, check for comfort and ensure the dressing is snug, not tight. Make sure it stays in place during movement. Change the dressing as instructed by your healthcare provider, typically every 24 hours. By following these steps, your hip incision will heal properly. Nevada Orthopedic and Spine Center is here for you every step of the way as you recover.